A new health alert out of New York City suggests that children may not be as resilient to COVID-19 as previously thought. So we have pediatrician Dyan Hes here to talk a little bit more about this. Dr. Hess, the last time we spoke, we were talking about a mysterious syndrome or illness that popped up in the UK with children who tested positive for the coronavirus. And now it looks like there's something popping up here in New York City as well. What can you tell us about it? Doctor, the last time we spoke, we talked about this kind of mysterious illness that was hitting kids in the UK, and it was connected to COVID-19. But now we have something that's cropping up here in the US. What can you tell us about it?
Well, they're just case reports at this point, but we are seeing, and I'm not a hospitalist, I'm a private pediatrician, but we are seeing increased incidence of atypical Kawasaki's disease. So Kawasaki's disease is a post-infectious inflammatory response that children often get, and it causes lymphadenopathy, rash, fever of 5 days or more, often conjunctivitis, like pink eye looking, irritation in the mucosa. So we are seeing that. You also have to remember that many of the children that we are seeing are testing positive for multiple viruses at the same time. So not all the children who we're seeing with Kawasaki do have COVID, and then some of the kids that do have COVID also have rhinovirus, which is a cause of the common cold, or adenovirus. So I think, I think we're all jumping on a lot of data that we see very quickly, but you have to remember that this data is like 2 weeks old. So, infectious disease specialists are working on it. We do know that COVID does attack the vasculature, which would make sense that they would get Kawasaki's disease because it's affecting the coronary arteries of the heart. That would be the worst case outcome. It is very treatable if it's caught early. We haven't had deaths from it, but it's just another thing for parents to worry about. And also, now when you see a rash, does my child have COVID rash? Does my child, this virus presents in so many insidious ways. I can't tell you the number of phone calls I get a day, because parents hear the news and then everybody thinks they have Kawasaki's disease. It's a little bit overwhelming for families.
I will say,
I'm sure
my daughter had Kawasaki disease, the one thing that was like a little different for me, sorry, Vlad, is she was sick, and you're right, like this, all these things sort of look very similar. The kids under the weather, they don't really know what's wrong with them, so they have like limited ways of expressing whether their stomach's hurting or whatever. So she was sick, but what caught me off guard was when I glancingly touched her hands and feet, she recoiled. And I thought that was really weird, that her hands and feet were clearly in some sort of pain, and that's the reason why I ended up going to the emergency.
And they often peel, their skin peels as well. So there's just so many manifestations of Kawasaki. It's really just important for parents to be in touch with their physician. I have to tell you what I've been seeing this week. I have some parents who've been very extreme about the quarantine. Like, they literally have not left their house for 6 weeks since this started. And now they're starting to go out slowly. A lot of them are moving out of the city because they realize that the schools aren't reopening. And now I've been getting a lot of phone calls of fever again. So I think what it shows is that kids can harbor a virus. It doesn't have to be COVID, but they can have it in their nasopharynx for maybe 8 weeks, maybe 12 weeks. And just by being quarantined doesn't mean that they don't have the COVID virus, or it doesn't mean that they don't have another virus. And I think that's causing a lot of alarm, because parents keep on saying, oh, can I move to my in-laws because we've been quarantined for 14 days or 6 weeks, whatever it is. But kids get sick the minute they get out.
Yeah, no, it's a serious concern, I think, for a lot of parents. And Dr. Hess, as you know, there are some countries around the world that are continuing to social distance, and Switzerland is looking to ease restrictions on children specifically so that they can hug their grandparents. Now, according to a lot of other doctors, this could be potentially dangerous, but it comes after the Swiss infectious disease chief claimed that young kids do not transmit the virus. So Dr. Hess, can you just shed some light on this? Are children with COVID-19 infectious?
Well, yeah, if you have COVID-19, you're infectious. The question is, are the children positive? So we don't know. We're not widespread testing, so we don't know the numbers in the United States. But I can tell you that Switzerland is a very different country than the U.S. We ski there almost every winter. It's a very homogeneous, less crowded, fresh air. They don't live in inner cities like we do. Even their cities are not as crowded. Now, you have to think about collateral damage. Yes, I love my mother. My children love my mother. I have a 13-year-old. We went to drop off food at my mother's house. I let her stand at the entryway with a mask, and I let her wave at my mom, because the outcome, if my daughter is carrying coronavirus, is going to be so much worse than if she hugs my mom. Do you know what I mean? Like, so we're taking chances. We're gambling with data that we don't know. So yes, in other countries, maybe the kids can go back to school. Maybe the kids can go back to school social distanced or with a mask. They don't live in crowded situations like we do. They don't ride public transportation like we do that is crowded. But I mean, I think that if your elderly parent has a risk of dying from a hug, the hug is not worth it. That's just my feeling. We don't know.
Yeah. Why take the risk? But it's interesting that, you know, this Swiss infectious diseases chief here is saying that kids can be carriers, but not transmitters. I don't think I've heard that before. Can you have the virus, but then not spread it?
Well, you can, right? So there's like 10% of the population probably carries strep. It doesn't mean that you have strep or you're giving it to other people. The question is, when does that viral load, like in your nose? When do you reach that critical mass that all of a sudden you do start shedding it to other people, that your nose is running? And you know how many kids wipe their nose, wipe it on their shirt, wipe it on the door handle. So I think that people want answers that we can't give them. And this is extremely frustrating when you hear your physician say, we don't know. So I think until we know, we have to be more safe. I think that my patients go home sometimes to an apartment where 7 people live in 2 bedrooms. And if one of them is your elderly grandma, maybe you should leave the elderly grandma alone and keep the younger children away until we know. I mean, that's just my feeling.
Dr. Hess, it's so great talking to you. Yeah, no, and I so appreciate that you come on our air, on a regular basis to talk about this stuff. And I don't know about you, Anne-Marie, but when I hear Dr. Hess and others shedding even more light on the coronavirus, and often that means that we don't have all the answers. But for example, when Doctor, you mentioned that some people in the population carry strep but don't actually transmit it, it actually gives me more of a sense of apprehension as we start to flatten the curve here in New York City, for example, which has been the epicenter for so long. I'm even more cautious about going outside or interacting with people as we start to learn more and more, because 3 months ago, 4 months ago, we didn't know a lot and people were less cautious. And now as we learn more, I feel like that actually gives us more pause. So I'm really grateful that you're here on a regular basis on CBSN to talk to us about this, Doctor, because I think you're providing a lot of useful information for people who are just like me, who really don't know. So we appreciate it.
Thank you. I just feel that people want answers from data based on 14 patients or 20 patients. And we are definitely seeing Kawasaki in New York, and they saw it in other countries. But that doesn't mean that every child or every person who gets COVID is going to get it. We don't know if there are certain gene types. Like I read from San Diego, one of the infectious disease doctors thinks that certain children have a certain gene type that predisposes them to getting Kawasaki. So there's just so many unknowns. And I always say this, I did HIV research in 1989 when I graduated high school. We still don't have a vaccine for HIV. And people, and I remember when I was in college at Hopkins, and they're like, oh, there'll be a vaccine soon, and there'll be this, and there'll be that. And yes, we can manage the infection, we can manage HIV and AIDS, but we still don't have an HIV vaccine. It doesn't happen so quickly, and people want answers yesterday.
Good point. Dr. Hess, always great to talk to you. Thank you very much.
Okay. Thank you. Be safe.